But what I was going to ask was, is there, so for people that are thinking, they've been listening to this episode, they've looked into this, and they're thinking, should I get on GLP-1s? I'm trying to figure out if like I'm a good candidate. Is there criteria that we should go by, that we should consider when considering if I should get on this or not, right? Like obviously this is approved for someone who's obese, like classified as medically obese, type 2 diabetics, and certain comorbidities. But, is it like, is some of the criteria, like maybe if I'm someone I just have mild weight loss concerns and I'm just looking for a quick fix, not saying that any of our viewers are doing that, but just like if I'm looking for something quick, does that mean like maybe I shouldn't do this? Is it as simple as saying if you're not ready for long-term change, these aren't for you, right? What are some things we should consider when deciding if we should get on these? But for people
Yeah.
that are wondering, is this for me? What does that thought process look like, do we think?
You know, I think it's so contextual and so personal for everybody, right? These are a tool, right? And just like anything else, tools can be very useful or they can be used inappropriately. And so, one of the things that I think about is one, does the use of these medications lower your overall risk of something bad happening from your health, right? We know that having a high BMI, every day you wake up with a high BMI, your risk is higher, right? So if these lower that, you lower your risk of a cardiovascular event, cancer, diabetes, etc. So I think in that aspect, if you utilize them and in 3 months you lose 10% of your body weight, or 6 months you lose 10% of your body weight, well, now you've substantially reduced every day you wake up, your risk accumulation is lower.